Good morning, everyone. Thanks for joining today's webinar. We're going to talk about creating an exposure control plan for employers as it relates to the coronavirus 2020. We've all seen the media hype, and it's unclear as to whether or not this is going to continue to spread globally. So it's best that we prepare our organizations as well as our employees to help mitigate the potential for that spread. So let's jump right into the presentation. First, to get started, we have prepared a program for employers. And the first step is to review the exposure control plan. We want to make sure that we amend the policy to match our organization's policies and procedures. So finalize that exposure control plan and then plan to review that with both managers and supervisors and even leads, as they're going to be critical in maintaining and managing the potential for the exposure. The next step, we're going to review the coronavirus safety tips. We have provided both of those in English and Spanish. And again, feel free to amend those to match your organization's policies and procedures. We took a lot of the information from the World Health Organization as well as the Centers for Disease Control. So I encourage you to view or visit both of those websites and find out more information, as they have, both of those have situational awareness updates on a daily basis about the coronavirus and the spread. So next, on step 4, we're going to provide that coronavirus training to all employees, and then we want to make sure that we obtain the signatures using the attendance form that we have attached to both of those training tips. And then of course, maintain those signature pages for record keeping, which is an injury and illness prevention program compliance requirement. Now let's talk about communicable diseases. These are infectious diseases mostly related to bloodborne pathogens or aerosol transmissible diseases, ATDs. So we have BPPs and ATDs. Those are commonly used acronyms, and both of those are Cal OSHA requirements. There are standards that you can look up under the Division of Industrial Relations website, and you'll find the specific details in order to comply with each one of those different requirements. Now, for bloodborne pathogens, we do have a bloodborne pathogens program that is available in our Insight portal. If you have one already, I encourage you to review that again and also review that with your managers and supervisors. Now, the ATD exposure is more related to healthcare workers, not so much the general industry. So if you are in the healthcare space and you are highly exposed to this potential coronavirus, we encourage you to review the ATD requirements and then also provide that training to your employees. And there are additional infectious diseases which can be spread through body contact, contact with body fluids, and so forth, as you can see here. Some of the potential exposures for bloodborne pathogens could be exposures such as hepatitis B, hepatitis C, and potentially HIV or AIDS. And those related to ATDs are infections that could be contracted through tuberculosis, SARS, smallpox, influenza, such as we're seeing with the coronavirus, as well as measles. Now, what are the responsibilities throughout the organization? And this relates back to element number 1 within your injury and illness prevention program, which is assignment of responsibilities. And at the top here, we have the safety manager. Could be your safety coordinator, safety director, environmental health and safety manager, whatever the name of that individual is. They're going to be assisting with developing this program, ensure that it complies with Cal OSHA standards, and then providing the tools to all of the employees to mitigate the exposure. They'll be helping to train the managers and the supervisors, and then those managers and supervisors will be training their subordinates or the frontline staff. The safety manager also will look across the organization and identify tasks and work environments where there is a potential for these CDs. And wherever those exposures exist, they want to have a specific plan around how we're going to decontaminate the area if there is an exposure, or how we're going to isolate an individual who might be deemed infected. So moving down the line, we've got department managers, supervisors, and leads. And these are the frontline managers, and they want to ensure that the exposure control plan is being actively implemented and managed appropriately. They'll also work with the safety manager to ensure an area that might be contaminated gets disinfected, and they take the appropriate procedures, which we'll discuss here in just a second. And then, of course, we have the frontline employees, and those employees are going to comply with the exposure plan, maintain an open line of communication with the managers and the supervisors and the safety manager, that if there is a potential for an exposure, they want to notify their upline to make sure that they mitigate the exposure before it becomes more widespread. All right, let's talk about transmission control procedures. Now, here are some basic procedures that we have established that you can adopt at your organization, but I do encourage you to review these with your safety committee, review these with your safety manager or supervisors, and refine them as needed. Number one, we want to utilize universal precautions to prevent ATDs and bloodborne pathogens and other potentially infectious materials, which are called OPMs. And we want to make sure that we treat the employees that are exhibiting flu-like symptoms as potentially infectious. So one of the things that we are recommending is that employers review their work from home policy, perhaps be a little more flexible during this outbreak period. Also, review your travel policy to make sure that if you do have international travel assigned to certain employees, maybe reevaluate that. And then also look at your sick policy, and maybe you're being a little bit more flexible with regards to PTO and sick time during this period. Now, we want to treat all blood and body fluids as infectious. So we want to take the appropriate steps, utilizing the appropriate PPE to both clean up and disinfect and decontaminate specific areas. We want to ensure all safes, needles and sharps, for example, are handled appropriately, and we are disposing them in the proper containment systems. And that moves me to the next one, number three, ensure safe handling of blood or open specimens. Now, make sure that you do have procedures where if there is a blood spill, that you are taking the appropriate steps, you've provided the appropriate PPE, and that you've also provided the tools or the containment system to transport it or dispose of it appropriately. After cleaning or disinfecting, or just in general being out in public, we want to utilize personal hygiene practices such as thoroughly washing hands. And I've seen several different recommendations from washing for 20 seconds to washing to 40 to 60 seconds. So what I would recommend is that you continue to wash your hands continuously throughout the day so that you can help, again, mitigate both the exposure to yourself as well as the spread of the exposure. We want to utilize personal protective equipment, and that could be gloves or goggles or aprons. Um, Depends on what the exposures are within your organization. So think through that process and identify what the PPE is required for your specific organization and maybe that specific task. And then moving on down the list to number six here, we want to clean and decontaminate any work areas or vehicles or any other equipment that we think may be contaminated or has been confirmed contaminated. So looking at decontamination procedures, again, work with your organization, your managers, supervisors, your safety manager, and define what those procedures are going to be within your organization. We want to talk about personal protective equipment. What's going to be required? Do we have uniforms or other clothing that is part of our PPE standard policy? And do we have to clean that? How are we going to do that appropriately? Looking at the different machines or hand tools or workstations within the environment. How are we going to decontaminate those areas? How are we going to quarantine those areas and then properly decontaminate them? And then is the same for vehicles, which is the last item there. Moving into the middle of the screen, we can see decontamination shall commence as soon as the exposure is known, including when the work surfaces become contaminated, perhaps an employee has notified us, perhaps we have identified an employee as being infected, perhaps there was a blood spill or other potentially infectious material that has created a larger exposure within that specific department. Or for healthcare workers, perhaps there is an airborne exposure and we need to quarantine that area and decontaminate that as well. And moving on to the right side of the screen, cleaning materials must be disposed of in accordance with your bloodborne pathogen program. Recall that I did recommend you should review your bloodborne pathogen program. You should have a disposal process in place. One option could be that if you have contaminated waste, you can notify your medical provider or your industrial clinic, contact them, let them know that you do have medical waste or contaminated waste, that you need help disposing of that, and follow what their protocols are, because they do have those at the clinic. And make sure that any receptacles that you do use with contaminated waste, that you want to make sure that those are cleaned, decontaminated themselves before you reuse them. Let's spend just a minute here on personal protective equipment. We've talked a lot about that through this presentation. And PPE can include gloves, safety glasses, goggles, respirators, and if you are requiring employees to wear a respirator, you want to make sure that you comply with the respirator standard of Cal OSHA. First, making sure that they've completed a medical evaluation. You want to make sure that they don't have any personal respiratory issues that could be impacted if they do wear a respirator. And then if they are wearing more of a cartridge respirator, you want to make sure they have a tight fit. So you have to go through fit testing. We do know that the general public is buying up a lot of the respirators. I've looked on Amazon and found most of those are unavailable right now. So they are in use out in the general public, and you want to make sure that if you or your family are using those respirators, that you're using them appropriately and properly, because if you're not using them properly, then they won't actually do the job. Other potential PPE could be rubber boots or apron. And then when you are handling contaminated waste, you want to make sure that you've identified what PPE is required. And then that last section here is what I mentioned before about the respiratory standard for Cal OSHA, Title 8, California Code of Regulations 5144. And if you have any questions with regards to that, please reach out to us. We've got policies and procedures within our Inside portal that are accessible to those consumers, and we're happy to help you both review those and then customize them to your organization. We've talked a little bit about regulated waste throughout this presentation. Regulated waste is a liquid or semi-liquid blood or other potentially infectious material or OPUM, and that consists of these contaminated items, which you can see here. As I mentioned, self-liquid, semi-liquid blood or contaminated OPUM. They are capable of releasing these materials when handled or compressed. Contaminated sharps, such as needles, and they can be pathological and microbiological wastes which contain blood and other OPUM. Blood has been a common theme throughout this presentation, so if you do have the exposure for cuts, lacerations, make sure that you have reviewed your bloodborne pathogen policy, you've identified your procedures for decontamination as well as disposal. Now, we talked briefly before about waste containers. Here's just a little more information about those. Some organizations might not have these, and you can get them through Granger or Amazon. Most of the ones I've seen are a red tin. They're self-closing, self-containing. They've got a biohazard symbol on the side. You might have the red biohazard bags as well that can also be used. And when those are in use, there is the exposure to the cans themselves or the tins or the bins. You want to make sure that you decontaminate those containers after they have been used, or if you feel that they are not decontaminated, then dispose of those appropriately. All right, here are some general health and hygiene tips. You can find more at the Centers for Disease Control, the CDC. They have a whole range of recommendations. Here's just a top few. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. And what's interesting is you probably don't realize how much you're actually doing that throughout the day. So be conscious of keeping your hands towards your face and keeping them down so that way you're not likely to touch your eyes or your nose or your mouth. If you're sick, stay at home. And one of the concerns I've had with one of our employers is that one of their employees was sick and they were going to provide them with a mask, although they didn't have coronavirus, COVID-19. There was the exposure that if this employee is wearing a mask, the fear factor is going to ripple outward. And so they decided to send the employee home until they're feeling better, just so that that potential exposure to being sick, as well as just the fear factor of is this person infected with COVID-19 is mitigated. We're going to cover our cough, cover our mouth when we cough or sneeze with the tissue and then throw that in the trash. We want to clean and disinfect frequently touched objects and surfaces. We can use regular wipes or sprays. And then also following just the CDC recommendations for using a face mask. CDC currently does not recommend people that are well wear a face mask, and only those that are ill need to protect others from this potential respiratory disease, such as COVID-19. Here's an exercise you can complete with your teams. Ask them where their biohazard containers are. And if you don't have any, consider purchasing one through Amazon or Granger or other provider. And then again, you don't want to store those in common areas, but make sure that your team understands what the disposal process is. And if those containers are used, that you are decontaminating them after use. So again, just a brief exercise you can have with your team to identify where those containers are and then the appropriate procedures to eliminate the exposure as well as decontaminate those containers. Here are some additional CDC recommendations for preventative measures. Voluntary home isolation. If you're sick, stay at home. Respiratory etiquette. If you're coughing or sneezing, make sure that you cover your mouth with the tissue and then throw that tissue in the can. And then also proper hygiene. Wash your hands frequently throughout the day. Again, that 20 seconds is recommended, but I've seen up to 60 seconds. So after you're going to the bathroom, if you're in the general public, even before eating, blowing your nose, coughing, sneezing, all of that, make sure that you are washing your hands consistently throughout the day, and that will help mitigate the spread to the exposure. Environmental health actions, routinely clean, frequently touched surfaces. We work with a lot of school districts, and so they're elevating how often they're cleaning desks, door handles, and so forth. If you have international travel requirements, maybe reconsider those. We know that the travel industry is getting hit pretty hard with this, but to prevent the spread of COVID-19 specifically, reducing the international travel requirements might be a benefit. And finally, what's important is consistency. Continue to practice these preventative measures so that you can help reduce the overall exposure to COVID-19. As I mentioned, we have developed two safety trainings for you. Each one of these, this is in English and Spanish, and each one of them has an attendance form at the very end. So feel free to print these out, review them with your team, recommend that your team takes them home and reviews them with their family. So this is a community outbreak, not just specific to employers. So make sure that you have provided training to your staff, that they're aware of the exposure and aware of preventative measures. Lastly, here are some resources for you. Centers for Disease Control, Traveler's Health Notice, Symptoms Check. The two standards that I mentioned before, bloodborne pathogens, as well as the aerosol transmissible diseases. And then if you do need sample plans, we have provided those to you, but you can also download them here at our website. We have a blog that has an additional Q&A information about whether or not claims are compensable related to infectious disease such as COVID-19. So I encourage you to review those. We'll continue to update those as we have additional questions come in. And lastly, I'll leave you with additional company policies that we recommend you review. Again, I mentioned the bloodborne pathogen policy, review your work from home policy. Perhaps you're more flexible during this period, and then your travel policy. So if you are having employees travel consistently or internationally, consider revisiting that policy and the requirements during this outbreak period. And if you have any questions, feel free to reach out to us. We wanted to just provide you some brief information about how you can create your own exposure control plan, and then policies, recommendations, and training that you can review and provide to your staff. Again, thanks for joining today. If you have any questions, please feel free to reach out. Thanks.